Hello, friends. Happy New Year. Happy 2024. If I haven't gotten a chance to say that to you yet, welcome back for all of my folks who have hung out with us before. My name is Jasmine Veles. I'm so happy that you are here. If you are here for the first time, or if you are returning, say hello in the chat. Let me know that you're here. Shout out to our members that are here in the chat today. And I just want to point out today's question of the day. What is your definition of a high deductible? If you were to answer that question in trivia, what would you say the answer is? And this is really a little bit of a trick question because there isn't really a right or wrong answer. And I'll explain that a little bit later. So what is your definition of a high deductible? And in this day and age, I feel like we all know very clearly what a high deductible is. So we all know very clearly what a high is, but we don't know what a low deductible is because it doesn't exist as much. Would you agree? So my friends who are here hanging out for the first time, I'm so excited that you're here. My name is Jasmine Veles. As I said before, this is Inlera University, specifically the Medical Billers Network Live. Here in this space, we are committed to alleviating the stress and confusion in the business of healthcare. And in this channel, on Thursdays at 2 p.m. Eastern, we talk medical billing and all things really revenue cycle related. So if you are new hanging out with us and this is something that you are interested in, consider subscribing. Make sure you give us a little thumbs up. Let the algorithm know that you want to hear more from us. So with that said, I'm going to pop open our little presentation here because we've got a lot to dive into today. So today we are talking about how to effectively manage deductibles. So if you have something you want to add to this conversation, because I know many of you, my folks who are in the practices on the ground, seeing the patients day in and day out, are already diving into this for the new year. So if you've got some tricks of trade and you want to share that, feel free to at any point share. You guys know this, I say it a lot. We are only better together. All of our knowledge, our expertise can be more powerful when it's shared, so we can make a greater impact and improve the delivery of how we care for our patients by just communicating, by sharing with the people in our community all the different things that we know. So with that said, we're going to talk about that in a second. Last week, we talked about how to ring in the new year right with medical billing or in the medical billing world, things that you really should be doing to look back on the previous year, to ramp up and plan and strategize for the year to come. So if you missed that, you're going to look on the channel underneath lives and you'll find that information on you'll find the live there. And if you're looking for the week before what we launched, because it was a holiday week, we actually published our interview with Miss Victoria Mull from Contempo Coding. If you are not familiar with Victoria, then you need to get familiar with her. She's a wealth of knowledge, a really wonderful human, and someone that is just going above and beyond for our community in healthcare and really giving such valuable content. So she has a phenomenal YouTube channel here and talks mostly around the world of coding and in the business of healthcare in general. But we had an interview with her that you can find on our channel as well under the videos tab. So check that out. We talked about medical billing versus medical coding and, have her insight and have her perspective, and let us know why she chose medical coding over medical billing. And perhaps that'll help you make the decision as well. So if you're new here, this is Inlera University. We have a bunch of other stuff in all of the technological world. So if you're into all these other spaces and places and you like to hang out there, then that's where you want to look. You can scan the little QR code. It'll get you all of our little links. We are going to be doing a whole lot of stuff this year. This year is big. We are super duper excited to give to you guys, our community. And so let us know what you're interested in seeing more about. Let us know what you're interested in learning about. If you're someone who is brand new to this field and need some guidance, some teaching, some training, we would love to be able to provide some of that to you here through the YouTube channel. And again, if you haven't haven't subscribed already, consider hitting that subscribe button, and you can hit the notification bell, and that'll just let you be told when we go live or if we're posting important updates like we will be posting this week. One of the really exciting and important updates that I want to share with you guys is that I have opened my calendar. And so you guys can directly book times with me if you're someone who's in the field and or interested in getting into the field and need me just for about some questions off of me, just a little bit of mentoring, a little bit of guidance for a short window of time. You can book a time directly one-on-one with me. It will be a Google Meet. It will be a video call. So be prepared for that. And yeah, feel free to use that link. You will see it in the chat. So like I said, keep an eye out for that. It'll be in the community tab here on YouTube, and then in the whatever other feeds on the other spaces and places you're hanging out. So if you're new to what we do, we have revenue cycle services, medical billing, and coaching, consulting through that arm, which is Inlera. We have a fully functioning medical billing company, for lack of a more over explanation there. and we also have education in a more formal sense. So we have courses and other community content within Inlera University. So if you are interested in getting connected to us through our courses and coaching, then you're going to want to check us out. Nicole is popping in the links for us in the chat, the links that you can be able to get into that information. And so, hi, China, great to see you. Hello. Tyra's in the house. Hey, how's it going? It's so great to see you. I love your picture. So great to see you, friend. The self-paced course is on the screen. That's the Medical Billing 101. So the instructor-led courses, the CPB readiness, is more of a coaching type program. You're with me quite frequently, and it's for the course of a number of weeks that are set on the schedule. Medical Billing 101 is more your time, your leisure. There is, it's all self-paced. There is no requirement that you complete it by a certain date. You will have legacy access to lifetime access, legacy to that particular program. All right. With that said, we're ready. Make sure you grab your pens and your paper because we are going to crunch some numbers. I like that, Nicole. Nicole always surprises me with her links there. So here we go. All right, or her links. What do you call it? Her pictures, the last little slide. So, all right, my friends. So here's the deal: is we are in the season where deductibles are the theme of conversation. A lot of the discussions in our practices this month, especially, circle around the topic of deductibles. And why is that? Why is it important? So most importantly, deductibles are the thing that can impact whether or not your practice will be reimbursed for a claim, period. All right. If someone has a high deductible and you don't have, let's say, billing information for your patient to be able to reach out to them to send them notification of their balances, and you did not collect while they were in the office, the insurance company will not be reimbursing you. All right. So let's just cover what exactly is a deductible. My friends who are in the chat, you guys know the answer to this question. Feel free to pop it in there. Anything that I chat about today, if you feel like you want to chime in, know that the door, the table, the whatever, it's always open. Whatever you want to say, insert the word, it's always open. Main thing is this: with deductibles, I want to make sure you guys understand what they are and how they function in a practice. So a deductible is the amount that needs to be paid for by the patient or the subscriber, the individual seeking care, the amount that needs to be paid by that individual before the insurance company will begin reimbursing the claims. All right. So that means if the insurance deductible is $2,000, that amount would need to be paid out of pocket towards that patient's care that's being billed, operative word, towards that patient's care that's being billed prior to the insurance company kicking in and starting to pay on the claims. So if you have a patient that has a deductible and the deductible applies, that patient needs to be the one to cover those visits. If they don't cover the visits out of pocket in the office, then you have to go down the process of billing your patient and waiting for payment from your patient. Now, we're going to talk a little bit about strategies that we recommend that you manage these deductibles so that it prevents you from worrying about your accounts receivables from your patients being the thing to rely on financially. Because as a practice, if you have a patient population that is coming to you in the start of the year, you are likely going to see a drastic drop in revenue if you are not collecting from those patients something towards their deductible when they come into play. All right. So we'll talk a little bit more specifically about that. But our deductible is the amount that needs to be paid by that patient, the person, the individual who's financially responsible, the guarantor for that care, that patient needs to cover those visits before the insurance company will reimburse. Okay. So when we talk about the significance of the start of the new year and why this topic is so huge at the start of a new year, is because a lot of our plans, the majority of the plans that we see, are what we call a calendar year renewal, which means that every time the calendar year begins again, January, the plan resets and it restarts. Okay. When that happens, all of the numbers get reset to what they were when the plan first started. So if our patient had a $5,000 deductible that they met in 2023 or the previous year, that deductible, if it was zero at the end of the previous year, it is now $5,000 again. Okay. So it's very important that you understand, though you had a patient that might have maxed their out of pocket, which means they could have been seeing you at the end of last year and the insurance company was paying 100% of your contracted rates. Amazing. That could completely go away when January comes around. Okay. So on the alternative, we have other patients that might have what we call a plan year renewal, which means that they're not impacted directly by the January date, but it's important to know that the patient's renewal period, because those numbers again reset on those dates. So if we know that our patient has a plan year renewal, you will have different notifications, hopefully, in your practice that will make you aware of the dates in which that will change. If the patient's on a calendar year renewal, then this individual patient is going to be at the top of your list in January. Okay. All right. I have a lot of questions that come through on our side about when is the right time to be verifying insurances. I have a lot of practices that try to verify for all of their patients before the new year starts. So there's a couple of concerns with that, is that not all insurance companies will give you future benefits, which means if you were calling in December, they may not give you January's benefits. So that's the first thing to know. Okay. And part of it is because a lot of the times these plans are being reevaluated and potentially renegotiated. If it's a group plan, they may not even have that information to confirm. Okay. So that's one consideration. The other thing is that if our patients are in our database, that does not mean that they're coming in January. Okay. Unless they have an appointment, they are not really a priority for us. Okay. So if you have a patient population of 1,000 patients, let's say your census is 1,000, that's how many patients you have in your database active, right? Within the last couple of years, they have been treating. Would you want to do a verification project for 1,000 patients? Or would you like to look at your week and say, okay, this coming week, we have 75 to 120 patients. We should verify those patients. Doesn't that sound a little bit more easily consumable to do 75 patients instead of having 2 weeks, 3 weeks of all hands on deck to do 1,000 patients re-verification to find out that a chunk of those patients' benefits were not even valid because the plan still restarted in the next year in January to something else totally different, or patients never even came in. They never even came in for the whole calendar year. You've got new benefit information, great, but who cares, because they're not your patients. So they're not coming into your practice. So it's important to try to really chunk this down into bite-sized pieces. A lot of folks think about in this in a much larger project. And when we're really thinking, we should really be thinking about just the days to come. And I said 75, and that might not be relevant to your practice, right? I would suggest this: get yourself at least 3 to 5 dates of services ahead, and then be verifying those future dates. So let's say if today is the first of the year, I'm going to try to be 5 business days or 5 dates of services into the year, and then be verifying one more day into the future as the days continue. So by the second day of the second day of the new year, I'm going to try to be verifying the 6th business day. And by the 3rd, I'm going to be verifying the 7th business day. So you're staying a few days ahead, because what will inevitably happen is you will have patients that will either call for, if you allow this, they will call for an emergent visit, one that needs to be seen pretty quickly. So within that 24-hour period. So you need to be verifying those patients' insurance, and you will have people potentially walking in if that's something that is allowed in your practice. So if you have those scenarios, you need to allow for those verifications to take place as well. So what you're doing when you're focusing only on one day and you're a few days ahead is, if something happens, God forbid, you can't be in the practice that day, or someone is out, the person who's doing the verifying, you're not worried. You're not shuffling or just kind of winging it for a day because that team member is out of pocket. Okay. Instead, you have a few days of a buffer. If they got ill, which we're in flu season, that happens. If they were under the weather and they weren't able to come in, or weren't as efficient with verifying and weren't able to get through all of the patients, we're not as concerned because we're a few days ahead. Very important. Now, other thing to think about is when we're focusing only on one day, we're looking at just the patients that are coming in that have insurance, health insurance during that period. So if you've got workers' comp, you have self-pay patients, you have other kinds of like EAPs or something like that, you're not as worried about those individuals, right? You're not worried about verifying those patients' insurance because it doesn't exist in the same fashion, okay? So you're looking further out into the future. You are trying to stay ahead so that you're not at the mercy of your insurance verification specialist schedule, whoever that has that responsibility. Often it's someone at the front desk. And again, things come up, things happen, right? Patient has a sick child, and a patient, your team member has a sick child or whatever, because again, it's flu season. You at least have built yourself a buffer that will protect you from that, and you won't be worried that your patients are being seen, and you're hoping and praying that those visits are compensated or reimbursed, So let's see. I see checking questions before I move on to my next point. I used to bill in and out of network, and I thought deductible had to be used in order to bill out of network. Okay, so deductibles apply both in network and out of network. There are major differences when it comes to out of network, because no matter what, your patient pays for the value of the care that they are receiving. Your fees, not required to be paying contracted fee. All right. So what that means is, if I typically bill $200 for a particular service, but I have a contracted rate of $75 with a particular insurance company, right? If Cigna, for example, reimburses me for that same service only $75 based on my fee schedule or my contract that I have agreed to as a participating provider, then the patient would pay $75, and I would not bill anyone else that $125 difference. It would be written off as a contract adjustment, a CO 45, a contractual adjustment, okay? If you are in network, it gets written off. If you are out of network, the patient could be liable for the full $200, okay? They would be responsible for the full $200, That is the rate that you as an out-of-network provider could bill your patient. Why the difference? Why does it matter to still bill claims? Questionable. Now, the deal is this. Patients sometimes still like to meet their out-of-network deductible if they have a provider that they like to see that is out of network, that eventually perhaps they could have a out-of-network, out-of-pocket, maximum met. So I'll give you an example, acupuncture. That's a service that for a lot of patients, they may not have coverage or the providers themselves are not in network. That just is a very common thing. But let's say I'm someone who's avid patient of acupuncture and I want to have all of my providers that I'm out of network with still be filing claims to eat away at my out of network deductible so that I can at some point at the end of the year not have to pay out of pocket for my acupuncture care. Okay. Very possible, happens all the time. There are a lot of patients that have fairly low out of network deductibles. And so it could be advantageous to them. All right. So that $75 that gets applied to that out of network deductible does still actually take that out of network deductible down, even though our patient is really, we'll say, on the hook, for lack of better, they're responsible for the $200. All right. I hope that makes sense. Out of network, in network is a really, really big conversation. And so I want to make sure that you guys are clear on that. When it comes to deductibles, just know when it's out of network, they're almost like self-pay patients for you. Okay. They could be in theory self-pay, and you could choose not to ever even file out of network claims. That is absolutely on the table if it's something that you would prefer not to do for the sake of kind of confusion and not having to make it more difficult for you to have these unique relationships. So, you're so welcome, China. Thanks so much. And ask away. Feel free to ask more questions. I have a number of other bullets here, but I do want to make sure that you guys really understand this topic because it's a really meaty one. And so the cool thing is we're starting this conversation and we have a lot of content on the books that will hopefully continue to illuminate more. So you guys will be like experts with deductibles by the end of this time together, for us to just all be just way more proficient. And even from as a patient, if you've always been confused about what the heck a deductible is or why it matters or how it applies, this is going to hopefully just take your knowledge to the next level, and you can speak from a place of confidence and hopefully a little bit more power. Yeah. All right. So we talked about the significance of the start of the year, what that really means for most plans. We also talked briefly about verifying and a little bit around creating or we'll say manipulating your verification project to make it more easily consumable instead of putting everything on pause. Like I've had practices actually that have told me like, what we do is we close our practice from Christmas to New Year, but all of our admin staff, they're required to come into the office and all they do is verify all day. And I'm like, well, that sounds like a lot of fun for what are the doctors doing? Are they verifying too? No, they're like just having fun and enjoying. And like, what about the managers? Oh, they're also off. Like, oh, great. So it must be really fun to work for your practice during the holiday season. So don't be that practice that like, puts everybody on pause for that because there's other ways to do it. And I'm not saying, don't do some admin days in December. I think that is the perfect time to have some like project dates for people to kind of like, hey, we've got an opportunity for us just to do admin days for 2 days out of the month of December where we are all working and no patients are coming in the office. This could be a really great time for it. But doesn't mean that you have to make your team required to come in for the entire holiday break because you think it's the only way to do it. There are other ways, and honestly, they are a bit more reliable because, again, if we look at things through the lens of what changes at the start of the year when the year actually starts, and also, when I say that with the insurance plans, and also what could potentially change on your schedule as the year starts, right? Like a lot of the times people aren't thinking about the fact that, patients are on vacation, they're busy, and as soon as that new year hits, you're going to be loading up your schedule with additional visits. So you'll at least have a plan to verify those patients. All right. So I'll talk a little at a later date about really how to organize that plan, Because there's a few other nuances and things that you'll want to take into consideration, like how to update the front desk or ensure that you're communicating with them about the changes, and different things that you'll want to take into consideration based on your software and your software's capabilities. All right. So one of the next topic is the differences between a high deductible and a low deductible, and why exactly do they matter? So the question of today was, what is your definition of a high deductible over a low deductible? And what would you say a high deductible is? And that's kind of a loaded question, because we see so many really high deductibles. Like we're on average somewhere between $3,000 to $5,000 is pretty average for our patients' deductibles. Sometimes we see even $10,000 deductibles, right? Now, the truth is, the only thing that matters for your practice is what is that in relation to your contracted rates or your typical or average reimbursement rate per encounter or per visit. So it might be a number that your practice calculates that says, here's my patient visit average. This is like on average, this is how much we receive per patient visit for insurance patients. It's like an average number across your insurance companies. What's the average for contracted insurances that you are receiving over, let's say, a self-pay, right? You deciding based on that number, the average, comparing that to what a deductible could be. So let's just say you're a very specialized practice that does a lot of different types of tests and exams in-house, and you are billing, or let's say you're a surgeon. Let's say that's a better example. You'd say you're a surgery practice, and typical patients that are coming in, whether they're doing in-office surgery or you are in the surgical room at the hospital performing a more invasive surgery. But on average, we'll say the average for a visit is somewhere around $4,000. Of course, not counting our post-ops and pre-ops. So somewhere around $4,000. Let's say that is the average. So you look at that compared to a deductible, they say the average reimbursement, right? The average contracted rate for that particular type of highly specialized surgery that you're providing, around $4,000, right? And a patient who has a $5,000 deductible doesn't seem so high. That's not that high. That's one visit, right? It's like you come in, you've got your surgery, not a big deal, right? But if you instead are an allergy clinic, allergy clinics, sometimes their medications, the different allergies, the injections themselves, they $20, $30, right? $5,000 deductible sounds ginormous compared to that, right? So obviously, someone's coming in at the start of the year, we are very likely going to see our patients needing, and if let's say that patient's on very healthy, otherwise, let's say it's a youth, someone who's very healthy and doesn't have to see the doctors very often, they're just going in for their allergy injections. They're probably going to be spending the entire year needing that $5,000 deductible. Okay. So I say that to make sure you understand what your practice's definition of a high deductible is versus a low deductible. And why does that matter? You might ask. It matters because your patients need to be informed of what your policy is for deductibles that are considered high deductibles or low deductibles, because that might change what you might be collecting towards the deductible. Okay. So I say this, let me give you a couple of little examples here. If I am a therapy practice, let's say, and I define a high deductible is anything over $2,000. Okay. I might say that if I verify your insurance and your deductible is above $2,000, then you are required to pay what our average contracted rates are. You might actually get that down to a science. Therapy practices, it can be quite easy because they're only doing a couple of procedures, and you can absolutely monitor your contracted rates to collect on exactly or close to the contracted rate for your patient. So you would be collecting that from the patient when they're coming in for care. And I'll explain to you a little bit about what I mean there in just a moment. You're going to collect that from your patient. So when you send your claim, insurance claim processes, it applies the deductible. We're great, but we don't have to then bill our patients after the fact because we've already taken care of the payment up front. Now, if I say that our patients are required to pay this only above $2,000, that might be in the event, let's say most of my patient population is Medicare aged, or folks that maybe are going to see the other providers or network of providers quite frequently. So if I know that my patient population, they're generally a bit more apt to see a lot of practitioners at once for a variety of reasons, right? They might be seeing 2 or 3 other providers in the first couple of weeks of the new year. That volume of patient visits eats up a $2,000 or a $1,000 deductible like that, okay? So if I know that my patient population is among those who are going to be seeing a lot of other providers, I have to keep in mind that we probably are going to see them meet their deductibles quite quickly. And the reality is this: you do not want to have a situation where you are feeling like you have to verify every single patient visit that they are coming into your practice, especially if you're a therapy practice or someone who sees your patients on a very recurring basis, like once a week or twice a week, okay? If you are that type of therapeutic practice or practice that is seeing your patients very regularly, a physical therapy practice is another example, then you are probably going to go nuts if you have to check deductibles that frequently, okay? What you'll want to do is create a very clear policy for your practice that says, if the person has less than $1,000, we'll do that for maybe the first 3 weeks of the new year. And then by the end of that first month, maybe the beginning of February, if they're still coming in for active care, you'll do the same thing again, reevaluate where the deductible stands. Because once more, if these patients have seen a lot of other providers, then they've likely met that $1,000 or $1,500 deductible within the first couple of weeks of the month. So here's the challenge that most of our billers find. And this is, it is not based on the time in the fact that the patient saw these other providers. What matters is the speed in which these other providers send their claims in, because that timing, that the turnaround time for those claims to get processed is when the deductible begins to reduce down, okay? If you go to a practice that has terrible revenue cycle management procedures in place and they take 6 weeks to get a claim out the door, if it was that $5,000 surgery that we talked about earlier, it doesn't matter until that claim hits the door of the insurance company and it gets adjudicated or processed. It actually has not eaten up the deductible. If you're a practice whose claims hit the door quickly and you are just right away sending for automatic adjudication after every day of service, you're just like firing off claims left and right. Awesome, love it. If you're doing that, you could be beating that surgery practice to the insurance company. And that can actually mean that your claims will process long before their claim will. And that would mean that all of your claims will go towards the deductible, and potentially by the time that surgery actually hits 6 weeks later, they will need to, those claims will be paid. The claim for that surgery will be paid, okay? So this topic is quite complex, which is why I want us to continue producing a lot of content, but just know the actual application towards the deductible, meaning the deductible having a reduction going from the $5,000 deductible to, $500 less and less and less it's only based on when the claims are actually adjudicated, meaning they are accepted and they're being processed by the insurance company. If the claim went right away from that surgery practice, but they sucked at correcting their rejections, that claim still didn't get adjudicated. The claim might have happened. It might have happened on January 2nd, but if it doesn't actually get adjudicated or processed until March 2nd, then all of the visits that the patient has been treated for and all the claims that have been adjudicated until that point are going to process towards that patient's deductible. Okay? Very important to know, it is not date of service specific. It's date of receipt, date of adjudication. All right? When the claim comes into their system and is accepted for processing or accepted for adjudication, those words can be used interchangeably, then they will take from those claims and put those visits towards deductibles. Okay? So it's super duper important that you understand that. And when you define your practice's policy about this being your high deductible number versus anything less being the low deductible, you need to make a very clear policy for whomever is collecting. If it's the front desk staff or your checkout staff, you need to make it clear to them what is expected of them. The reason why a lot of front desk team members do not collect is because it's not clear. They don't understand. And when someone doesn't feel confident or feel comfortable, they will not want to tell a patient that they must pay $250. Because if the patient balks at it and says, but why? Who's on the line? Who's the one who has to answer their challenging? I'm at a loss for words today. I'm getting over a sickness, so my brain is bleh. So who's the one who actually needs to be the one to address their objections? That's a best way to put it. That is the front desk person, the person who is there facing them at the moment. Yes, they might be able to escalate it to the next person, maybe a manager or supervisor or something like that. But most of our practices would like our front desk or whomever is responsible for collecting to be able to have autonomy and do that with confidence. They don't want to have to be escalating every patient back to their supervisor or to the front desk manager or office manager at that. Okay? So be aware that if you have this really willy-nilly, oh, well, sometimes we collect and I don't know, sometimes we don't. And if the deductible is kind of high, like you have all these exceptions to the rules and they're not clear, what that does is turns for your front desk and they will not collect. All right. And that will 100% have front end impacts, like massive impacts on your revenue, massive impacts on what is actually taking place cash flow wise in your practice. And then downstream, if you do not have a solid AR process, a recovery process for your patients' receivables, then you are going to suffer. Your practice is going to suffer if you don't have the process of billing your patients, sending them down the proper channels to get them aware that they're responsible for these deductibles, then you're going to suffer. And most patients no one wants to receive a statement in the mail. And no one wants to receive a statement in the mail that they were not expecting. So it's different if you told them, hey, we're going to require that you pay us this estimated amount towards your deductible because we know that your deductible is over X amount of dollars. And according to our policy, we require that you pay towards it. But this is an estimate. And until the insurance processes your claims, we won't know exactly how much you owe. But just know that once we get that fleshed out, we will send you a statement for the balance or send you a check in the mail for any credit that we might owe you. It's very important that you mention that because most patients, if they're smart, are going to ask that question. Well, what if I overpay? If you don't have a policy that defines what you will do when the patient overpays, first of all, it's just poor practice. Second of all, it just means that you aren't thinking of the entire scenario, right? You're not thinking about what happens if the patient has paid you way more for the deductible and you're the practice that dragged their feet to get the claims out the door and they met their deductible with other practices. All right. If you're that practice, then you're going to fall into this situation where you will end up owing patients a lot of money. And that's just not where we want to be. Okay. It's not where we want to be. So yes. So I mentioned about putting the policy together. Here are the things that you'll want to really address in your policy. The couple of different, let me check my chats here. I haven't seen. So sorry. I'm so sorry, you guys. Hi. Okay, here we go. Oh yes. Hi. Okay. This was China guessing the high deductible being 5,000. Yeah. I'd say 5,000, it depends on the practice, right? What we talked about. So as the biller is the policy, policies you suggest. I suggest to my provider something that my provider has to enforce in regards to how we collect deductibles upfront. Oh, as a biller, meaning as an outside biller? As an outside biller. So here's the deal. Yes, if you are there as a trusted advisor for your practice and you're managing the revenue cycle, so in theory, as a medical billing company and as a vendor, you are a trusted advisor, right? You are directly connected to the financial performance of the practice. What that means is that those of us who collect, especially based on commission rates, meaning we are working off of a percentage of what the practice brings in, it works to our advantage to advocate for them to have better practices, right? This is why the model of commission has worked so well, because we are directly tied to the success of the practice. And it just means when they win, we win, right? And so it helps all of us. Now, if you are advocating for them to collect upfront, you have to make sure you're clear about the benefits, because practices can get stuck in things that, well, it always worked this way. Like 25 years, we've always done it this way. What you need to be sure of is you need to communicate, well, here's the numbers. Here are the number of patients we are sending to collections, and here's the amount that the collections company sends us per month, probably like $25. Just being sarcastic, but it could be something very pitiful compared to what you're graduating to collections on a regular basis, right? Patients that are going all the way through your patient collection process and graduating to an outside collection agency. When that happens, those numbers can be quite illuminating, because they can tell us that something's not working in our practice, right? Can tell us that, hey, like we've got way too many patients going to collections and they're just not paying anything. Like, to be frank, no one really, when it comes to lending, no one really cares about medical debt anymore. And so most patients are not thinking about you sending them to collections. There's some people who are just honest and don't like owing people money. And there's a lot of other people who could care less. All right. And so you're at the mercy of that reality. It's a harsh reality, but it's a reality. And so when we have those types of scenarios in our awareness, we start thinking of the best things that we can do on the front end. It keeps everybody honest. It keeps everybody in the loop, right? And then, like I said earlier, be real. That you need to be willing to, when you're willing to collect from your patients, you need to also be willing to send them their refund checks if you owe them money. Like, I cannot tell you, I see with these patients that have credits out the wazoo and they just don't send them the money. And I don't even understand that. Like, you're okay hounding your patients, but you've got patients out here with hundreds of dollars that you owe them, and you're not sending the checks. Like, even on an annual basis, you're not sending the checks. It's not just best practice. If there's a level of compliance that is impacted if you're just breezing over that. So, all right, I went off of that. So I love that. This is something that clearly gets me a little fired up. So here, I'm going to skip over here. So yes, I know. Yes, overpayments issues are a problem, and it's a reality. And this is something that I like to always communicate to them as as proof to that is, you get just that one patient who's smart and who starts blowing whistles at you. Basically, they're like, hey, I see my EOB. They get an EOB in the mail. I see what it says that I owe you this amount, and I know what I paid you. Why haven't you paid me for that? And, all it takes is just that one really smart and savvy patient to reach out to that one really smart and savvy class action lawyer. And there you go. It's something very, very easy that someone could stir the pot on, especially if you're one of those really, really naughty ones that have thousands and hundreds of thousands of dollars sitting out there to your patients. All right. Why is it Why is it not based on appointment? Yeah, that's a great question. So why is it not based on when the appointment was? It's because the insurance companies don't want to be stuck in this like constant reprocessing of things, right? It's like if I said that and you send me a claim in December because my timely filing limit, I'm insurance, okay? If you send me a claim in December for a date of service in January and I applied a bunch of claims to deductible, now I've got to be taking into consideration this entire year worth of claims that needs to be reprocessed. So it would be a big nightmare. So yeah, that's a great question. So let's see. Front desk always has to give the bad news. It's awful when you don't have clear reason or process. It's true. It's so unfortunate that, we don't always think about how hard it is to be the face of the practice. And when you have that responsibility and our folks in leadership over the practice are not thinking about your knowledge and your skills, like they aren't thinking about the fact that you have never in your life faced someone with financial objections to anything. Okay. You have never had an uncomfortable financial conversation because you're 20 years old or the age of our front desk, sometimes they're fresh out of high school or college, right? And here you are putting them in this position to ask for money and without helping to build their confidence, right? To take that into consideration. What is the skill set that our front desk has? Okay. This actually brings up, we've been doing a bunch of interviews and I'm super excited for you guys to see these interviews being launched up. So you saw the one with Victoria, but we did one with Felicia Belfast and that one's going to be, I think, coming up. Is it this week, Nicole? I think it'll be up this coming week. And you guys, I think are going to benefit so much from that. And she is a practice manager and talks a lot about, the importance of like really building up the staff. And you guys are just I think you'll really love it. So just know that it's a really, really challenging place for folks to be in if they are not being trained well, if you're not equipping them with the knowledge and the skills to help them find confidence to collect from our peoples. All right. I like it. Nicole, can you tell I don't miss front desk? Yeah, definitely can tell that. I love it. So funny. All right. So I'm going to zip through these last 2 points because we're at 50 minutes. Listen, this is the thing. As I said already, deductibles, big topic. We have a lot of content coming out related to deductibles. I do want to keep answering any questions that you guys have or things that you're confused about in that content release. So if you're like, hey, I don't understand this piece about it, let me know. Just popping the comments, whether in the chat now or after when you're watching this video later on. That would be great because we didn't actually get the announcement out about this topic until late. We've been busy with interviews and other things that we've been changing. We're changing project management systems, all kinds of stuff. And so we're like, oh, okay, today's the live. We're going to make sure we didn't even announce it. So that's why if you're watching this, you're like, I didn't even know they were going live today. We're back on our weekly lives, 2 p.m. So just know that it will be. And so you can pencil that into your calendar and know that if we end up by mistake forgetting to put it out there sooner, that's why. All right. So we put about the policy. We're going to create your policy. Here are the most important things to put in your policy. So you're going to address in your policy why this policy exists. Why is it that the deductible policy is necessary? I like to define why it matters to the patient, right? We don't want you to receive a bill in the mail and be alarmed by the amount. We are trying to keep you aware of your responsibilities prior to you receiving the care, right? Because we're talking about collecting this if, of course, you know what services are going to be provided in the back office. You're letting your patients know prior to that care being provided. Prior to that care, but yeah, felt like I was using the same word. So you're making sure you're advocating the why according to them. Like, why does it matter? Okay. And it's really there to help protect them. All right. You are explaining to them how the amounts are calculated. Why did you come up with this estimated amount, right? Why does that number matter to your practice? You're explaining to them what the renewal period is, whether or not it's a year, annual renewal or plan year. You can define it in your policy to explain that it's going to depend on their insurance, but really there's 2 different types. And it's important for them to know that the effective dates that show up are typically an indicator of when their plan renews. So if it's January 1, 2024, that their plan renews January 1, 2025, right? Hopefully it renews. If not, then it terminates and it's something else comes in its place, okay? So it's important to talk about the plan renewal. You also want to talk about what happens in your practice's eligibility. Like, hey, we call insurance, we try to get the best information possible, but we, just like the insurance says, right? We are just providing the information as it was provided to us, and it is not a guarantee of any benefits being paid according to the information we received, right? So you're essentially just spitting back to the patient, parroting back to the patient what we got from the insurance company, which is their, fun disclaimer that says that we're telling you all this, but we could just be lying. Who knows? Like, just send us a claim and see, which is kind of what happens. And so there's always that like opportunity for like a possible change. Okay. So again, I'm not an attorney. Again, I should say this. I'm not an attorney. I am telling you what my recommendation is on your financial policies. You need to make sure you consult with your own healthcare attorney for your practice, because you also want to make sure you are speaking to whatever is required or prohibited in your specific state. But these are typical things that we see in our financial policies and the things that we want to be weaving in or answering for our patients and advocating for them to be paying in advance. Now, when our patients have certain types of plans, we cannot do things like that. Medicaid plans are an example of that. There are some other plans as well, or things that you want to take into consideration that will never have deductibles, like the VA, right? Our VA patients won't have deductibles, okay? So you'll want to keep that in mind. Our Medicare patients have deductibles. They're very, very small. Anybody in our chat right now know what the deductible is for this year? I haven't looked it up personally, but Medicare is very small. And so if I have a Medicare patient that's coming in that has a Medicare plan, then they are going to probably eat that up in one visit with most of their providers. All right. So we've talked about the policies. And the policies themselves, you create your policy, introduce it whenever is right for your practice. Ideally, you're reevaluating your policies every year, just checking to see if you need to add something in. But let's say you didn't have a financial policy that touched on deductibles. Now's your chance. Add it in, put it into your policy, and make all the patients re-sign that particular financial policy. You can just post it on your front desk and have some sort of line of adjudication or line of attestation that they received it in your software. Okay, and let them ask questions if they have. Now, verifying deductibles, we talked about re-verifying deductibles when your patients are coming in. Let's say they weren't on your schedule, they walked in, or let's say these patients haven't been in a couple of years. You're going to make sure that you make time for re-verifying these patients' insurance. And if you've already done the vast majority of your patients that were coming in at the start of the year, it should be that much easier, and you have a lot more of a clean process, right? I believe that the best practice for verifying insurance is staying days ahead, period. So if you have an eligibility system that checks your patients that are on your calendar, perfect. If someone does not have an insurance that is connected to your eligibility tool, your real-time eligibility tool, RTE tool, then you are going to create a process to log on to whatever website that needs to be connected to get the benefits, okay? Really, really important to know. You need to make sure that the deductible, according to that patient's plan, applies for the service or the specialty that you are performing in your office, okay? It's very common that there are specialties to which the deductible does not apply, okay? If that happens, then we have this conversation about deductible with our patients, and you collect from them and the claims get paid. You're like, owe your patients a lot more money, okay? So really important that you know whether that deductible applies, okay? Typically, if you're verifying insurance through something like an Availity, there is a line that indicates whether the deductible applies or not, okay? All right, today was a lot of information, I know. So our lunch and learn still stayed within an hour. It went the full hour though. So that's why I was okay, we gotta get in at the beginning, because this topic is it's a meaty topic. And if you leave this video and you're like, I still don't know, and I don't know, I don't understand. If that's your feeling, please let me know. Tell me in the comments. I want to make sure that I like put my arms around you and like, we're going to do this together. Don't worry. I will make sure that I get you some new videos and content to help you kind of like, really wrap your head around it. We're doing some long form videos and some shorts related to this, so know that. But if there needs to be another live where we do kind of like a little breakdown of it just to address questions up front, cool. We'll do that. So let me quickly check. Oh, I got some things here. Can the deductible be collected in the doctor's office? Oh, yes. Yes. So China's asking a great question. I recommend that they collect the deductible up front. An estimation towards the deductible is ideal. Now, let's say that you have a really fantastic system. Just like I say this and I kind of giggle like under my breath because I'm like, system, there's no such thing really as there's some really good ones out there, but they're not all perfect. But if the system lets you not have it happen at the front desk and you can do this all, prior to the visit, cool, great, do that. But I do recommend before you treat your patient, you are collecting. And yes, it is allowed. A lot of people ask, like, I didn't think that was allowed. Yeah, it's 100. If you know what care now, if you were like, let's just say you don't even know that you're going to be providing a particular service and you're just like, we're just going to collect it anyway. Like, let's say patient is coming in for an evaluation for something. You don't want to be collecting towards something that you don't believe the provider has actually prescribed for your patient, right? Like, we're collecting for things that we know are taking place during that visit. I know there are some specialties that they don't know what the doctor's going to do back there. I get that. So that in those instances, what happens is at checkout, you are collecting from your patients or something towards it. And it's so important. If you don't know the numbers, you got to think about it from your perspective. If you don't know the numbers and you go back to see a doctor, right? You're like, I have no idea. I have insurance. So many patients in the past used to think that insurance is like a credit card. I have insurance. It should cover everything. Like, listen, if you don't know the numbers, you don't know what's going to be what's going to be required of you, it will make you, the patient, breathe more peacefully and to say yes to care if you know in advance that there is a chance that this visit could cost you this amount to this amount. So give them a range. If the doctor prescribes this happens, or does this particular procedure back there with you, here's what could possibly happen because you have a deductible. Okay. So letting them know up front is so important. And if that can't happen, or if there's too many variables in your practice, then what you're going to want to do is insert a financial advisor, someone in the middle of the transaction that can intercede and tell the patient before, hey, just to make you aware, when the doctor does this particular procedure, it's going to require this. We typically require this towards it. However, we can still provide this and you would be invoiced for the difference if that's, again, in your policy. All right. We don't want our patients not to get the care that is necessary for them, but we do want them to be able to make their own informed financial decisions, because it is a financial decision at the end of the day. Okay. It is a health decision, something that we want them to be able to receive with confidence, but we also don't want to cause them other health issues like stress and anxiety and all of that. Okay. So I love it. All right, let's see. Well, verification is something that I missed often. Yeah. Listen, there's so many practices out there that don't do verifications. You got to do 100% verification for every single patient. I don't believe that you have to do that. What I do believe is that you should be checking eligibility for all your patients. Eligibility is different for verification. And there's some videos, I think, that we have that point to that very clearly. But basically, your eligibility tells you whether a patient has coverage. We're happy with that. If you don't do a detailed verification, I'm okay with that. As long as you know the basics from that eligibility, you know that they have coverage, you know that they have a deductible, that's fine. Okay. So don't get too down on yourself, Tyra. I love it. Oh, yay. I'm so happy. Thank you so much. I'm happy that you found it really, really helpful. So hi, Erica. Great to see you. Thanks for hanging out. Yay. You're so welcome. Level Up Medical Coding. Thanks so much for hanging out. I think I've seen your videos actually. Thinking about I just thought about your name. So yay. Thanks for hanging out with us. All right, friends. So let me know if you have any other questions at the moment. We are going to celebrate our members. If you are not sure what I'm talking about, you're going to want to check out our channel memberships. I started to say this earlier that we could have this in a Q&A conversation, but that wouldn't be relevant for most of you if you're not a channel membership, because if you are a channel member, you are going to be a part of I think we're doing monthly Q&As, our monthly Q&As, which I don't remember. So the calendar's not in front of me, and I don't remember when our first one starts, but we have Nicole's laughing in the back. We're like, I don't know, because like things are just we have so many things going on right now. It's in a good way. But our Q&As are on the books for our level 2 members. So we did have our level 2 release this month, and it does involve our Q&As. And so we've already put those on our calendar, and we've mapped out literally the entire year through December. So of all things Inlera use. So you guys don't want to miss out. And if you're not you don't know what we're talking memberships, you can pop into the link that Nicole just popped in the chat, and feel free to jump in. All right, friends, listen, next week we have that video with Felicia coming out. You're going to want to check that out. There's an interview that'll be out there on Tuesday, I believe. And then we are live again next Thursday. So until then, my friends, stay warm. I know it's cold in all parts of the country right now. Stay warm and stay well, and I'll see you guys in the next video. Bye-bye.